So BPC 157 is a peptide that is being used to help with injuries for soft tissue repair, ligament, tendon, muscle tears of any kind. So a very, very common issue, especially for people that do heavy resistance training, is they get some problems in the elbow here, tendonitis, or also known as a tennis elbow. So whether or not it's a tendon issue, ligament, this is a really, really difficult place to do a self-administered injection. Obviously, you will have two hands and you're gonna have to use one. So how do you do that? Because you have bone here, there's not a lot of subcutaneous fat here either. So I figured out a way to use just a simple chip clip, and this is what we do. I've already cleaned the injection site, so with alcohol. So what we'll do, now we just take the chip clip and grab a pinch of skin. Obviously a good idea to clean your chip clip, sanitize that prior to doing the injection. So this is about a 350 microgram dose of BPC 157, and I am administering that every day. So once we have that chip clip on there, it gives us a nice area to administer a subcutaneous injection. So now we just go right here. So this is a good way to stay away from the veins, the bone, the joint. There's just a lot of things to hit. So if you do it this way, you can do that with one hand. Easy as that. Remove the clip. And you're done with the chip clip.